It's a pleasure to be on the HITLAB stage again, and even more exciting to be joined by Dr. Vermenton. We've had the pleasure of working together over the past couple months now, and the work that he's doing in his practice in really creating exciting and meaningful and inclusive patient care is truly remarkable. So I'm going to get by starting. I start by saying, when HitLab first approached you, Dr. Vermenton, about introducing remote patient monitoring into your pediatric practice, what were your thoughts, and what actually made the decision for you to decide to start incorporating it?
So, first of all, thank you very much. Thank you for the opportunity to, talk with you and express a little bit of my gratitude to be involved in this project. So, probably like around 9 months, probably around the end of November, you guys approached with this idea, which I found like really, really interesting because as a kid, I'm a pediatrician, right? I'm a kid in my heart. I used to watch the Jacksons, so usually I used to watch like the doctor doing like kind of a televisit, and you know that during COVID time we have the opportunity to develop and also implement that idea. So it was pretty interesting to me that this type of devices can be used as a plus in primary care and also like in a hospital settings if you are like trying to push this forward.
And as you began to use the Woddle, which, for those of you who do not know, is a smart changing pad, meaning that we have an advanced precision scale built into the Woddle. As you began to start using it, what stood out to you clinically?
So to be honest with you, as we started like doing the process, it was super comfortable to me with a patient that had twins, and a patient with had twins, come up from the nursery. The patient is for you to come to the clinic is a big process, and sometimes in my population also it's a little bit costly. Usually you don't take the train to come with twins. You have to take like an Uber or a cab, right? So decision making, I decreased the amount of probably visits to this type of patients because it was more comfortable with mama, and usually the weight I was following with these patients, it was pretty close to the weight that we did in the clinic. So it was pretty helpful, at least from that part in my practice and my decision making.
Got it. And was there any like aha moments where the platform or the solution changed or reinforced your decision making?
Like pretty every time the patient will come to the clinic, it was like okay, this is pretty close to the weight that we can record. So I think I can trust this mom that is following the instructions and also is giving the data back. So I think I'm gonna minimize the visit. If she has like any concerns, probably gonna trust more in her like view. Um, and it was something like that. That was probably the aha moment that it was pretty close and pretty accurate of whatever we were seeing in the clinic.
Got it. And from your perspective as a pediatrician, what makes a digital health solution truly useful given your busy clinical practice? And where do you think that some products miss the mark?
So in primary care, if you have like your private practice, one of the first concerns of the patient is patient waiting. Sometimes you have like a lot of visit that you supposed not to have in your clinic, and it takes time from the front desk, from your clinical staff, and from the doctor to probably realize something that you couldn't be it couldn't be done at home. Let's say that you think that your baby is breathing funny, or you think that the oxygen saturation is off. Probably with these devices, you can, like, if the mom is well trained, that the mom that was working with us, the mothers that were working with us were, I think that can, minimize this type of visit that are unwanted in your clinic. Also, as a, let's say that you are coming from the NICU and you have this patient that you're following because of weight, and you are trying to see if the patient is gaining weight for real, instead of going to the hospital like pretty often, you can follow digitally. Also, patients that have failure to drive, usually you have to do like a weight check and calorie in and out intake in 3 days to see if it's something that the mom is doing wrong or the father is doing wrong. Uh, you can also follow every day, those 3 days. You don't have to wait for the third day and realize that the patient is not gaining weight, uh, to make a decision.
And where do you think, if you have evaluated other digital solutions, whether they're hardware or software, whether they're scheduling all the way up to what we have with Waddle, where do you think there could be improvements? Like what, in terms of workflow or um,
So
clinical
it will the
burden or
improvement.
education, where do you think there's opportunities for improvement, not just in the Waddle product, but what you wish you could tell all sorts of digital health founders?
So integrated in the platform, in the EMR and EMR, the integration, it will be something that if it's easy to integrate in the EMR and also cheap, that will be awesome. Another thing is probably the training of the parents. Sometimes the parents, like, when you set up something, sometimes you don't take the advantage, because we, as a human beings, I don't know any human being that will read all the instructions. So with these devices that are a little bit delicate, probably a person that goes and train them well, so you can take all the advantages of these devices.
Got it. And in terms of where you think there's opportunities for technology, whether it's hardware, software, AI, to make an impact in pediatric care, where do you think some of the opportunities are in terms of what pain points you see as a clinician and a
Well,
practice leader? Yeah.
we are running through AI, so it makes things more easy. It makes things faster. I think technology and AI is the future. Probably in my practice, we implement AI basically for everything. It will give you like a hinge, even though it's not something that probably it's super accurate. So it will give you hints. It will, like, set up like alarms. It will let you know how the patient is, and even in your sleep, you can wake up and you will have like a message. Oh, I think you will check this. You have to check this patient, and you will go and probably schedule like a visit or a televisit with this patient, and it will be like super nice for the follow up. That is something that sometimes the clinician, because we manage a lot of patients, we may miss.
And one thing that you noted early in the conversation was really about accessibility for your patients, where your practice is located in terms of transportation, in terms of ease of access. What can you talk a little bit about your particular patient population and how maybe some of the challenges around technology, but also the opportunities?
Yeah, the challenges around this type of population is like the accessibility. Probably they don't have, the money to buy a device like this. So it will be awesome is if like the insurance may cover it. It will be like great if you have like the necessity of this device. If you are a premature, and we need to follow you closely. If you're a patient that is not gaining weight, I think it will be super awesome that the insurance can cover right away. Probably
Awesome.
not initially to everybody, but patient who has the needs.
Yep. And that's where like a lot of these remote patient monitoring codes that we've
Yes.
been using with other practices have come in handy because it is a covered, a covered service, especially in New York.
Yeah.
Um,
Other thing is, for example, patient that has had like any problem with any social issues, and he has like an ACS case, and now have like a new baby, and you want to make sure that this mom is doing their job. Also, it can give you like that information.
Interesting. That's great. Is there anything else that we haven't discussed today that, you've been on your mind in regards to where technology companies are making and missing the mark when it comes to uniquely pediatrics?
Um, only the integration only the integration to our practices ourselves, like
Mhm.
basically in New York, to be honest, the pediatricians are like the old school pediatricians, and they get like attached to the old technology without knowing that this can make like a very huge impact. It makes you like take better care of your patient faster, and the patient will be happier.
All right. Well, I thank you so much, Dr. Vermetten, for joining and sharing your insights.